I'm becoming increasingly radicalized, ladies and gentlemen. Radicalized for liberty. Radicalized for taking it to it and breaking it up. And I'm going to tell you another reason why in a second. But this federal government is becoming increasingly inhumane, increasingly vicious, and it needs to be addressed. And so I'm becoming increasingly radicalized, even though I was pretty radical conservative to begin with, you'd say, right? This post-constitutional thing, whatever it is, you know, we do this fan dance where we pretend we're living in a constitutional republic. We're not living in a constitutional republic. We're not living in a constitutional republic. And I'm sick and tired of these men and women in black robes acting like judges. And now the Redskins, after all these years, no, the Redskins, that name's unacceptable. We're stripping you of your federal protection. We actually had the city council in Memphis, or some crowd in Memphis, vote to dig up a Confederate general's body and his wife, which is buried, I guess, on some state property. The founder of the Klan, by the way, not exactly a great guy, but now we're going to be digging up graves? What the hell's going on here? Just stop putting flowers on it, that's all. But that's not even what I'm talking about. This centralized federal Leviathan has turned on we the people. It has as its main objective controlling us, coercing us, putting us down, undermining us, destroying our lifestyles, destroying our private property rights, destroying our businesses, destroying our jobs. The federal government is not your friend. It's oppressive. It's tyrannical. Now, I'm going to explain what's got me worked up here. Even in the New York Slimes, they're reporting on this. Medicare plans to pay doctors for counseling on end of life. And I'm going to get into this. Sarah Palin talked about death panels. She was mocked, and not just by Democrats, by Republicans. She was mocked by the Wall Street Journal. She was mocked over and over and over again. Death panels, death panels. They are death panels. I'm going to explain in a second. This is the biggest story of the day. Just like yesterday, the biggest story was not the Confederate flag. Andrew Young is right. Who cares? The biggest story yesterday was Obama nationalizing zoning so he can destroy the suburbs in the country. And nothing happens, not even a peep. Where's Boehner? Boehner's looking for signs of the Confederacy on Capitol Hill. They want to hunt him down. They want to break him. Why don't they just bring the Taliban in here and give him the job? They know how to do that stuff. Listen to this story and see how screwed up our news media are. See how screwed up our priorities are while this out-of-control, iron-fisted central government keeps marching on. Medicare, which insures 55 million older and disabled Americans, announced plans on Wednesday to reimburse doctors for conversations with patients about whether and how they would want to be kept alive if they become too sick to speak for themselves. Now, this is a family matter, ladies and gentlemen. Families have these discussions. Children with their parents. Not the federal government paying doctors and nurses to have this discussion so they can just wipe them off the Medicare rolls. And trust me, they're going to pressure hospitals to do this stuff and doctors and nurses to do this stuff. They're already pressuring them to push people out the door. Let's continue. The proposal would settle a debate that raged before the passage of Obamacare when Sarah Palin labeled a similar plan tantamount to setting up death panels that could cut off care for the sick. The new plan is expected to be approved and to take effect in January, although it will open for public comment for 60 days. This is the game. Oh, we have 60-day public comment. Public comment on what? 98% of the American people don't even know what the hell's going on. And it's not even their fault. The government shouldn't be involved in these things, and the government's involved in everything. Medicare's plan comes as many patients, families, and health providers are pushing to give people greater say about how they die, whether that means trying every possible medical option to stay alive or discontinuing life support for those who do not want to be sustained by ventilators and feeding tubes. That's not what this is. This is the government pushing to say that you don't want to be kept alive. They want those beds empty. They want to move you out. And it's happening right now. I know people in their 80s and 90s, they're having this done to them, trying to push them out at the direction of the federal government. Here's the medical officer, the chief medical officer for the Centers for Medicare and Medicaid, Dr. Patrick Conway. We think that today's proposal supports individuals and families who wish to have the opportunity to discuss advanced care planning with their physician and care team. We think those discussions are an important part of patient and family-centered care. Oh, it sounds so swell and wholesome. This is family-centered care. They don't give a crap. It's not family-centered care. It's get the hell out of the hospital. Dr. Conway said a final decision on the proposal would be made by November 1. The plan would allow qualified professionals like nurse practitioners and physician assistants, as well as doctors, to be reimbursed for face-to-face meetings with a patient and any relatives or caregivers the patient wants to include. Dr. Conway said the proposal did not limit the number of conversations reimbursed. That is, pressure. You have an 85-year-old, 90, 95-year-old father or mother or grandparent. You're trying to get them the best care you can, which is very, very difficult in Obama's America. You already have the hospitals pressing you to, well, have you had this conversation if you have an elderly parent or grandparent? Well, they are 90. Well, they are 87. They've lived a full life. Have you had that? I've heard this. Is that the kind of conversation they're getting paid to have? The reality is these conversations, their length can vary based on patients' needs, said the clown. Sometimes they're short conversations. The person has thought about it. Sometimes they're much longer conversations. Sometimes they're a series of conversations. Now, Medicare has a zillion codes. Doctors will tell you this. Hospitals will tell you this. A zillion codes for care and coverage. And I cover this in my book, too, in Plunder and Deceit. Oh, yes, I talk about the senior citizens and what they're up against, too. Code after code. Thousands of codes. Thousands. And now they're going to add codes for end-of-life discussions. How many have you had? You'll get reimbursed for how many you had. You had 10? Okay. What was the outcome? What was the outcome? You never thought you'd live to see this day, did you? The major medical organizations, this is the New York Slimes now, building the case for the government to encourage people to pull the tubes. I'm telling you what it is. Major medical organizations endorsed Medicare's proposal. The National Right to Life Committee opposed it on grounds it could lead to patients being pressured to forego treatment. Of course, that's the whole purpose. Why have a discussion otherwise? Because the default position is to keep the person alive, to talk to the family. Well, what do you want to do? Well, keep them alive. Well, let's have some conversations for which we're reimbursed. The reimbursement rate paid under the proposal and other details will be determined after public comments are received. People covered by Medicare account for about 80% of deaths each year. It's just not enough. You old people aren't dying fast enough. Why do you keep hanging on? Because Medicare often sets the standard for private insurers as well. The new policy would prompt many more doctors to engage patients in such discussions about their preferences. So let's just look at this. So if they're having discussions with the patients, that means the patients are not senile, they don't have Alzheimer's or dementia of some form, right? That means they're competent enough to have a discussion. And they're lying there in the hospital on their back, maybe with a respirator, who knows? Maybe not. They're trying to get better. Maybe they had this conversation with their family, and the nurse and the doctor are paid to say, you know what, Charlie, look, you're 89. You're 89. I'm not saying anything's going to happen to you, but you're 89. Maybe you have, a 10% chance of walking out of here, Charlie. What do you want to do? Now, that person, that 89-year-old, 87-year-old, 91-year-old, 73-year-old, whomever, whatever, should be focused on getting better, trying to keep their spirits up, even if it is their last days. They don't need to talk to a stranger about end-of-life options funded by Medicare. And, of course, it'll never be abused. They don't abuse people at the VA or the IRS, at the EPA. No. Never. Every federal employee is good-hearted and noble and virtuous. Every doctor and nurse, good-hearted, noble, and virtuous. Let's continue. Efforts to support end-of-life planning were derailed in 2009 during the debate over Obamacare. The next year, Medicare decided through its regulatory powers to allow coverage for, quote, voluntary advanced care planning, unquote, in annual wellness visits. Annual wellness visits? So the person isn't even necessarily in the hospital, and they want to have a conversation about how they end their life or whether they end their life. And this is supposed to be health care. This is supposed to be medical care. Do you want your government doing this? But soon after, the Obama administration capitulated to political pressure and rescinded the part of the regulation. This is what I talk about all the time, folks. Our fools in Congress, our fools in the Republican Party, and other fools, they're surrogates, If they can't get something done in 12 hours or 12 days, they surrender. Look, Obama's never going to sign a law, so let's only pass laws that Obama will sign. The left will not take no for an answer. They lie to the American people. They usurp the Constitution. They exercise powers they do not have. It does not matter. They will not take no for an answer. As a big part goes the New York Slimes, as a big part of the American population ages and more people live longer with grave illnesses, a growing number of people want to be able to talk over options with their doctors. So, fine. What does that have to do with the government encouraging Medicare, through Medicare, doctors and nurses to have that discussion? Somebody wants to have the discussion, I'll have the discussion about whether they want to die at home or in the hospital or under what circumstances they want life-sustaining treatment. I'm going to tell you what's going on here. Not only does Medicare want to cut costs by cutting benefits to the people they're supposed to be supporting, senior citizens, and the sickest among them, the most elderly among them, but it wants to come between the family and the patient. There is no reason for a doctor or nurse to be affirmatively raising these issues and to be paid, to be subsidized to raise these issues. That's what families do. Burke Belch, director of the National Right to Life Committee's Powell Center for Medical Ethics, said his organization objected to Medicare's plan under current circumstances. He said, we feel there's pervasive bias against treatment that is occurring in advanced care planning that involves nudging individuals to reject life-saving medical treatment. He's exactly right. Otherwise, why would the government do this? And by the way, I don't want to hear any more how compassionate the left is, how compassionate Medicare is, how compassionate the federal government is. The only reason this regulation is going to happen is because they want to cut costs and they want to cut off the breathing tube to senior citizens. There's no other reason to have it. And they want to come between children and their parents. That's what they're doing. Shouldn't this be issue number one today all over the country? Well, Aunt Susie, I understand what your niece and your nephew are saying, but forget about them. We're asking you, we're the professionals, we're the healthcare experts. We're asking you, what would you like to do? You don't need to listen to them. What would you like to do? I can just see it now. Well, daughter Susie, your mother, Mary, she's getting up there in age now. I mean, we have to have this discussion, don't you think? No, I want her to get better. No, I think the time is now. I mean, she's 89 years old. We have to have this discussion. Jeez, I tell you.